Comprehensive Guide to Kyphosis. The video is created by Dr. Abhinav Gupta and team. In this video we have covered everything about the topic from initiation to the end. Kyphosis is a spinal disorder characterized by an excessive outward curvature of the spine, leading to a rounded or humpbacked appearance. This condition can affect the thoracic, mid-back, or thoracolumbar, lower mid-back, regions of the spine. Types of kyphosis. 1. Postural kyphosis. Often attributed to poor posture and muscle imbalances, postural kyphosis is typically flexible and correctable with proper exercises and posture correction. 2. Scheuermann's kyphosis. Scheuermann's disease is characterized by structural changes in the vertebrae, leading to wedge-shaped and irregularly shaped vertebrae. It commonly affects adolescents and may cause a more rigid kyphotic curve. 3. Congenital kyphosis. Present at birth, congenital kyphosis results from abnormalities in the development of the spine during fetal growth. 4. Degenerative kyphosis. Associated with the aging process and degeneration of spinal discs, degenerative kyphosis may result in a forward curvature of the spine. Stages in kyphosis. Kyphosis is often described in terms of its severity or angle of curvature. Stages may include mild, moderate, and severe kyphosis, depending on the degree of spinal curvature. Anteriorly and posteriorly. Anterior kyphosis, excessive forward curvature of the spine, leading to a rounded upper back. Posterior kyphosis, less commonly used term, but it may refer to backward angulation in a specific context. Methods of examination of kyphosis. 1. Physical examination. Observation of the spine's curvature while the individual is standing, bending, and in various positions. Assessment of posture, alignment, and any visible deformities. 2. Goniometry. Measurement of the angle of kyphosis using a goniometer during forward bending or in the standing position. 3. Clinical tests. Adams forward bend test, an observational test where the individual bends forward at the waist, and any asymmetry or hump is noted. 4. Neurological examination. Assessment of neurological symptoms or deficits, especially if kyphosis is associated with spinal cord compression. Radiograph for kyphosis. 1. X-rays. X-rays provide detailed images of the spine, allowing measurement of the kyphotic angle and identification of any structural abnormalities. 2. CT, computed tomography, scan. CT scans offer cross-sectional views of the spine, useful for assessing bony abnormalities and vertebral wedging. 3. MRI, magnetic resonance imaging. MRI scans provide detailed images of soft tissues, helping assess spinal cord or nerve compression associated with kyphosis. The choice of examination method depends on the clinical presentation, suspected causes, and severity of kyphosis. Consultation with a healthcare professional, typically an orthopedic specialist or spine surgeon, is important for a comprehensive evaluation and management of kyphosis. Surgical management for kyphosis. 1. Decompression surgery. In cases where spinal cord compression is significant, decompression surgery may be performed. This involves removing bone or tissue to relieve pressure on the spinal cord or nerves. 2. Osteotomy. Osteotomy involves cutting and repositioning the vertebrae to correct the alignment. This procedure is used to address severe cases of fixed or rigid kyphosis. 3. Instrumentation and fusion. Spinal instrumentation, such as rods, screws, and hooks, may be used to stabilize the spine. Fusion involves joining two or more vertebrae to prevent movement between them. This technique aims to correct deformity and maintain spinal stability. 4. Vertebral column resection. In extreme cases, a vertebral column resection may be performed, involving the removal of an entire vertebra to correct severe deformities. 5. Posterior or anterior approach. The choice between a posterior or anterior surgical approach depends on factors such as the location of the deformity, the degree of correction needed. Physiotherapy treatment for kyphosis, conservative. 1. Posture education. Focus on postural awareness and correction to prevent further progression of kyphosis. Emphasize maintaining a neutral spine during daily activities. 2. Stretching exercises. Target stretching exercises for tight muscles, particularly in the chest and hip flexors, to improve flexibility and reduce kyphotic curvature. 3. Strengthening exercises. Develop a customized exercise program to strengthen the muscles that support the spine, especially the core, back extensors, and scapular stabilizers. 4. Core stabilization. Incorporate exercises that specifically target the core muscles to enhance stability and support for the spine. 5. Breathing exercises. Emphasize diaphragmatic breathing to improve respiratory function and promote better thoracic mobility. 6. Postural bracing, if prescribed. In some cases, especially during periods of rapid growth in adolescence, a brace may be prescribed to support proper spinal alignment. Physiotherapy treatment for kyphosis, post-operative. 1. Early mobilization. Initiate controlled and supervised mobilization exercises to prevent stiffness and promote healing after surgery. 2. Range of motion exercises. Gradually introduce range of motion exercises for the spine, focusing on flexibility without compromising the surgical site. 3. Strength training. Progressively advance strength training exercises, taking into account the surgical approach and instrumentation used. 4. Functional movement training. Include functional activities that simulate daily tasks, helping the individual regain functional capacity post-surgery. 5. Core stabilization. Continue with core stabilization exercises to maintain spinal stability and support. 6. Pain management strategies. Utilize pain management techniques, including modalities and positioning, to alleviate discomfort associated with the surgical procedure. 7. Patient education. Educate the patient on movement restrictions or precautions after surgery and provide guidance on long-term spinal health. 8. Home exercise program. Develop a customized home exercise program to encourage ongoing self-management and rehabilitation. The physiotherapy approach varies based on the severity of kyphosis, the underlying causes, and the type of surgery performed. A thorough assessment and collaboration with the surgical team are essential to tailor the physiotherapy treatment to the individual's needs and ensure a safe and effective recovery. Always consult with healthcare professionals for personalized guidance and care. Vote of thanks. Thank you for watching our video. We hope this information has been valuable to you. If you have any further questions or concerns, please consult our team for personalized advice.